For me specifically, and I'll wear my professional hat to answer this question, obviously I tend to think in the context of AI and healthcare. Right? So the information that we see flowing in the healthcare domain is how I would relate to AI. And considering the fact that AI obviously could offer you the speed, could give you information, but at the same time, if it is misinformation, then the velocity with which AI could amplify, could disseminate things, that's also something to think about. Especially in the context of health, I think it's very different. A simple typo doesn't mean an error. A simple typo could actually mean an effect on patient, to do with the life and death of the patient. Think about the consequences of that misinformation on a particular patient, their carers, families, and say for example the population at large. So I tend to look at AI from that particular lens, considering that I come from the medical publishing background. So I think that's how I look at it. I think our responsibility has always been there since ages. And if I think about my organization, and our legacy goes back to almost 180 years back. And we are known for the trustworthy information that we produce. And what happens in the real world settings, in order for you and your audience to understand, there is the research which happens. Right? Now research many times is being done so as to improve the patient outcomes. So there has to be a translation of that research into clinical practice, but ultimately keeping at the center of it the patient outcomes. How does it benefit or harm the patient? That's what you are really trying to do. So our role has always been very important since ages, but I think with the current times, and I would not even say with the current times, world has been evolving at a very fast pace. Think about the internet, think about social media, think about the AI now. So I think our roles have also evolved, and I think we are that custodian of trustworthy information, and our role becomes even more important than what it used to be, say historically or in the past. And so we are doing few things in the real world settings to ensure that we could really give people the confidence that they very much seek as they absorb the information. First and foremost, I think it's very timely, very, very timely, considering we've just had the AI summit. So it's important that we continue to have this dialogue. And the very fact that this is happening here at the British Council, I'm very happy, to be honest. I said it also when I was speaking. I represent a British organization, British Medical Journal Publishing Group, which is, and UK is known for doing some extraordinary, exceptional research, high quality research, and what it has done for improving the practice and the patient outcomes. So very timely, and I think from the standpoint of the place where we have all assembled today, that's the British Council, all the more it makes it more impactful, more meaningful. So that's what I would say. You asked something more beyond this. If you could just repeat it for me, or that was the only question you had? I think the very fact that different people today, they met, they interacted, and I'm not just thinking from the standpoint of the speakers, the panelists, the moderators, most of them from the media and from the medical publishing, who knows who were sitting in the audience, and the audience would have been a heterogeneous mix of different people. So I think it's a good exchange of thoughts, and specifically if I were to relate it to what we do and what the media is trying to do, especially the newsrooms, I could see that there are synergies. In fact, I would take a step ahead to say that the newsrooms could actually learn quite a lot from the publishers, from the medical publishers. Let me take a moment to make you understand. Now, publishing for ages has really anchored itself in very sound research, research which can be reviewed, research which can be validated. So research, or you say evidence, we've curated evidence for ages and we continue to do so. So, and there is more to it. Think about in the context of, say, the conflict of interest, COIs. Right? So as a medical publisher, we are very particular about ensuring that we have the proper checks and balances in place. So I think COI play a very important role. I think these are some of the facets from the medical publishing which the newsrooms could also learn. Right? And especially they could then ground their news, their reporting in information that is evidence-backed, so that they have absolutely full confidence that what they are producing, what they are disseminating is really anchored in very solid evidence-based medical research. And once you do it, think about the effect downstream at the level of the end user, the consumer. They probably would be more confident in absorbing and doing something with that information that they would have received. I mean, having heard so many people, I think if I do that, if I create a word cloud, right, of all that I heard today, I think the biggest thing for me at the center of it, bold with the biggest font, would be trust, right? So that's the biggest takeaway. I think everybody is trying to seek or get that trust. What I am getting out of AI, whatever information I am receiving, either through prompts or whatever is circulating on social medias, on the internet, whether I can trust this information. So trust, I would say, is the biggest takeaway. It has always been, but only thing that this meeting did for me, it has emphasized or re-emphasized the fact that trust is not going to go anywhere. The level of trust, the trustworthiness is something that's only going to become more important, bigger in times to come.